Hi, my name is Thomas Loew. I'm a physician and I am a professor of psychosomatic medicine and psychotherapy at the University of Regensburg. I would like to introduce to you a new relaxation technique which we use since more than 50 years now in Germany. While traditional methods like Autogenic Training or Progressive Muscle Relaxation or imaginary techniques induce a general relaxation near to sleep, functional relaxation is functional. For example, doing something, you could be handicapped by a discomfort, but you have to finish your job. So relax while doing something different. Relax functionally. Functional relaxation. What are the advantages of functional relaxation? It needs only seconds. It is easy. You have not to practice, only to learn the rules and apply them. It is everywhere applicable, while you're sitting, standing, lying, even walking around. And it's scientifically proved. Basic knowledge and practice of functional relaxation is learned within 8 hours of course, and up to now thousands of patients and also colleagues learned this method for self-regulation and functional relaxation during their jobs. It is a creative method. You develop at the end your own functional relaxation, and you can integrate it into other activities like high-level sports or using it to foster your concentration. First, I would like to explain you what functional relaxation is not. It is not muscle relaxation, which was developed by Edmund Jacobson in the 1920s. Learning progressive muscle relaxation means you learn to relax in contrast to strain isometrically your muscles. You have to practice it maybe a quarter of an hour a day for some weeks or months while lying on the ground or sitting in a special position. Functional relaxation is not autogenic training, which was from Johannes Heinrich Schultz also in the 1920s. Coming from hypnosis, he uses formulas like arm heavy, arm warm, until you feel the sensation using trance phenomena, like a kind of self-hypnosis. Autogenic training must be trained for months too. So, what is functional relaxation? It follows rules. First of all, we start with a body scan wherever we are with regard to body sensations, for example, pain or discomfort. Second step, we describe these sensations in a kind of inner dialogue as precise as possible. Third step, body awareness is important. To retrieve it, proprioception, we concentrate electively on parts of the body, like during the body scan, but we introduce the sensations moving the small joints without effort 3 or 4 times, and it's not an exercise. It's very liberally, creatively moving. Fourth step, while moving and concentrating on these sensations, we naturally breathe out as our breathing goes. We do no respiration therapy. Then, after 2 or 3 times, we stop the muscle activities in the joints we moved and concentrate furthermore on the sensations in our body in this moment for some seconds, and we verbalize what we feel in a kind of inner dialogue. And then we restart again with the same joint or another sensation. So what? Seconds. Why do we need 8 hours to learn this new method? We practice body scans. We learn more about our bodily sensations. We learn a vocabulary to describe better our bodily sensations. Why? Because you can only remember what you have expressed with words and combined with sensations. We practice with different joints. You have 276 in different positions, while sitting, standing, lying. We develop your personal functional relaxation exercise, and we document and compare with other relaxation techniques as Autogenic Training or Progressive Muscle Relaxation. Is functional relaxation really something new? Yes, it is. It was developed in the 40s of the last century by Marianne Fuchs, a movement therapist, with a training by Prof in the Roaring Twenties. Marianne Fuchs was also influenced by Professor Ernst Kretschmer, a psychiatrist with a phenomenological point of view. Therefore, we observe and describe exactly the bodily sensations. And she was influenced by Professor Victor von Weizsäcker, a neurologist, which did introduce a connection between pathos, burden, and biography into medicine. And he was the inventor of the Gestaltkreis. Therefore, we compare the sensations during inspiration and expiration, and we connect the sensations with personal experiences of our life. So, it is really something new, functional relaxation? No, it is not. Every culture on earth since 10,000 years knows interventions similar to the ones described by Marianne Fuchs. Pranayama yoga in India, Qigong in China, Hakomi in the American Indian peoples, etc. Even breathing therapy has something in common. But in the German tradition of breathing therapy, the movements are larger, like gymnastics, and the focus on the breath is clearer. But it is something different from meditation or the modern awareness meditation techniques, because of the movements of the small joints, which you won't find in meditation and which are essential in functional relaxation. And functional relaxation is different from the method of Moshe Feldenkreis. He was an Ukrainian physicist which invented the method where the movements are already developed and trained. So, if you like it, try it. See you. Bye bye.